name's Mike. I'm from Ace Health Centre. I'm here today just to give you a rundown on a taping technique that I use instead of low dye taping. It can be used for any pronatory disorders such as plantar fasciitis, ball of the foot pain, Achilles tendonopathy. We're using two types of tape. I use a rippable stretch tear tape that's really handy. It's basically better, I find, than other sort of tapes just for the fact that you can rip it off really easy instead of having to get out the scissors and then just cutting through it. The other type of tape that I'm going to be using is just a standard sports rigid tape through there. I'll start off with this technique. We're just going to put an anchor strip on just above the ankle. This is going to be used just to then tape off the other pieces to stop it from slipping. Next, what I'm going to get the patient to do is to pull their foot back towards them as much as I can. You're then going to get half of the calcaneus and going to apply a piece of tape pulling through the inside of their arch. This creates a bit of a supinatory effect just through the back of the foot. So you're going to go up the inside of their arch. You're then going to use a second piece up the inside of the arch, which is going to overlap the first piece of tape. This again is used by starting from the outside of the foot, getting the patient to pull their foot back towards them, and then pulling up through the inside of the arch once more and anchoring off onto the strip just above the ankle. You're then going to grab your piece of stretch tape, which then is going to be applied from the outside of the foot. Put this piece on without any stretch whatsoever, just to make sure that it sticks firmly. You're then going to go around the outside of the foot and link up with the first piece of tape that you then put on. The first piece around the outside is done with about a half stretch. You're then going to make sure the patient has their foot pulled back towards them as much as they can once again. You're then going to pull up with excess force through the inside and then taper off through the top without any stretch once again, just to make sure that it nice and firmly sticks. Next piece, you're basically going to repeat the first piece. Alright, so again, putting it down with no stretch through the inside. This is overlapping half of the first piece that you put on once again, and just basically going around the inside of that non-stretch tape that we put on secondly. You're then going to go around the outside again with a medium amount of stretch, get the patient to pull their foot back, and then you're going to firmly pull up through the inside of their arch, and again strap off through the top without applying any stretch whatsoever. Again, really easy to rip this stuff off. You're then going to apply a last piece of anchor tape just across the top of the ankle just to firmly secure and support them. As I said, a lot simpler than low dye taping. I find it a lot more effective as well. So give it a go and give it a try. Leave a message and let me know how you get on.